Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Today we are looking at ETDRS, which stands for the Early Treatment Diabetic Retinopathy Study Classification. So first, there are two varieties we need to know. One is a non-proliferative. One will be the non-proliferative DR. Next will be the proliferative DR. So it is proliferative DR, that is a diabetic retinopathy. Now let's look at the non-proliferative DR. So we are calling it as NPDR. So under NPDR, it includes there is mild, moderate, severe and very severe. So what is the specialty of the mild? Mild means there is at least one microaneurysm must be present. So it has at least one microaneurysm. Next is moderate. Moderate, it includes microaneurysms or the intraretinal hemorrhages. That is, it includes in 2 or 3 quadrants. So these aneurysms are present in 2 or 3 quadrants. Next, what is to be noted is there is early mild intraretinal microvascular abnormalities. So we are writing it as IRMA. And there are also hard exudates and cotton wool spots. It may or may not be present. So hard exudates and the cotton wool spots, it may be present. Next is we saw mild, moderate. Now we have severe. So severe has something known as a 4-to-1 rule. So now we move on to the mild. We saw mild and then we saw moderate. So this is nothing but moderate. Then we move on to the severe. So under severe, there will be the 4-to-1 rule. So what is the 4-to-1 rule? 4-to-1 rule means that there are 4 quadrants of microaneurysms and extensive intraretinal hemorrhages. So you can see that 4 quadrants are involved and 2 quadrants are involved in the venous bleeding. So 2 for the venous bleed. Next is 1. 1 stands for the quadrant for the IRMA changes. So what is IRMA? We already discussed. It is the early mild intraretinal microvascular abnormalities. So IRMA is the intraretinal microvascular abnormalities. So this was about the severe. Next we move on to something known as very severe. So very severe NPDR. So very severe NPDR, it includes 4-to-1 rule again. So this includes 4 quadrants of microaneurysm and extensive intraretinal hemorrhages. So there's 4 quadrants of the microaneurysms. So 4 quadrants of microaneurysms and then the extensive intraretinal hemorrhages. Intraretinal hemorrhages. Next is the 2 quadrants. So the 2 quadrants, it includes the venous bleeding and 1 quadrant of the IRMA changes. Next is we move on to the PDR. So PDR, it stands for the proliferative diabetic retinopathy. So here the first variety will be without the high risk characteristics. So without high risk. So it's also known as the early PDR. So what does this include? So this will include the early neovascularization of the optic disc or the neovascularization elsewhere. Next is the PDR with the high risk characteristics. So next is with the high risk characteristics. So what does the high risk characteristic include? So this will include the NVD. So NVD will be less than the 1/4. So NVD will be less than 1/4, and this is of the disc area, and disc area with the VH. VH stands for the vitreous hemorrhage, or the PRH, this is the VH, that is the vitreous hemorrhage, or the PRH. PRH stands for the pre-retinal hemorrhage. Next is the NVD. NVD is 1/4 to 1/3. So this is 1/4 to 1/3, and this is of the disc area with or without the VH or PRH. This is of the disc area, and this can be with or without. So with or without the VH or the PRH. Next, to characterize it as the clinically significant macular edema, there should be one criteria which should be fulfilled among the three. So to classify it as the clinical significant macular edema, so under this it will include, the first criteria will be, so this is seen with the slit lamp with the 90D lens. So the 90D lens is used, and what are the characteristics? The thickening of the cornea at or within 500 microns of the center of fovea. The thickening of the retina. The thickening of the retina at or within 500 microns. So 500 microns, and this is of the center of the fovea. Next is the hard exudates at or within 500 microns. So hard exudates at or within the 500 microns. And this will be at the center of the fovea, associated with the adjacent retinal thickening. So this is again the center of the fovea, and this is with the adjacent retinal thickening. Next, we look at the development of the zone of retinal thickening. Next is the development. The development of zone of retinal thickening. Development zone of the retinal thickening. So the development zone of retinal thickening of one disc diameter or large in size. So 1 DD, that is one disc diameter, or it can be larger in size. Next, there is at least a part of this should be within the one disc diameter of the foveal center. Next, in case of the advanced diabetic eye disease, so what are the findings we are seeing? So in terms of advanced diabetic, so advanced diabetic eye disease. So under this, what are the things we are seeing? So there is a persistent vitreous hemorrhage. Next will be the tractional retinal detachment. Then comes the neovascular glaucoma. To learn and grow daily like this, please do subscribe.